Hi, I'm Dr. Navpreet Bhuttar, Head of the IVF in the Gynae Unit at Indus Super Speciality Hospital, Phase 1, Mohali. Today I'll be talking on infertility. Infertility is the inability to conceive after 1 year of unprotected intercourse in a couple. Infertility is a taxing problem to have. These days, the kids are career-oriented, they have late marriages, they plan pregnancies too late, they have a sedentary lifestyle, a lot of laptop usage. That leads to a lot of problems. In females, we have PCOD, and in males, we have sperm counts, they are less, the sperms are not moving. The end result is they are not getting pregnant. Patients come to us with the problems. Ma'am, we went to a hospital and they advised us IVF straight away. Ma'am, they advised surgery straight away. They should understand why, as doctors, we have advised a certain situation, we have advised a certain treatment to a patient. And as doctors, we must explain to our patients, why are we advising you IUI? Why are we advising you to go in for IVF straight away? Let's say a patient comes to me, they are married for, let's say, 6 months. They are both young, both 25, 26 years old. They are trying for 3-4 months and they are not becoming pregnant. Now, such a patient, I'll just advise a simple semen analysis, lest the patient comes out to be azoospermic later on, and a simple transvaginal sonography in the mid-cycle, so that I know the lady is forming good eggs, her endometrial, her lining, her uterine lining is good. If these reports are normal, I will not go in for any further invasive testing, any painful testing. I just tell them to relax, tell them their mid-cycle, give them an iSure kit to monitor their ovulation, and mostly the patients come back with a pregnancy in 6-7 months. This is one kind of patients whom I will not advise any invasive surgery. Now comes another group of patients. They are married for 2-3 years. They used contraception for 1 year, and then they are trying since last 7-8 months. Both are close to 30. Now they are getting anxious. Such patient, I can't just send them away. I need to do the basic testing, the semen testing, the ultrasonography, plus I'll need to test the lady's tubes. Frankly speaking, to become pregnant, you need 1 egg, 1 sperm, and 1 open tube. So these basic tests have to be done. Plus, I'll go on for some hormonal evaluation, thyroid test, and prolactin, her AMH, anti-Mullerian hormone. These days, a lot of ladies are coming with premature ovarian failures. So I need to rule out that also. And this patient, I may need to give some medication for egg formation. If she's PCOD, if she's obese, I may have to ask her to reduce her weight, then come. And this patient may need even intrauterine insemination. Then there's a third group of patients. They are married for 7-8 years. Both are 35, 36. They already have been to multiple doctors. They know what is their problem. The husband is having severe sperm problem, or he's azoospermic, or the lady has large fibroids or endometriotic or chocolate cysts, or the lady has tubal block. They may have undergone some treatment at various hospitals at various points of time. They are the patient who need real good care. I may have to go in for laparoscopy to remove the fibroids, to try opening the blocked tubes, to remove her cysts, and then they need vigorous monitoring. I need to go bang on with ovulation induction, egg formation, sperm injection inside, and here my threshold for advising in IVF will be less. She is a patient who in another 4-5 years may have a totally zero reserve. So here our threshold for IVF is less. I can advise her IVF after 6-7 months of treatment if she's not conceiving. And the last group is a group in which the only advice is IVF. Let's say a lady, a couple whose only son or only child has expired. The lady is 55, the husband is 57. How will they conceive? A husband who is azoospermic, a lady who is 45 years old, and they are married for 15 years. They have been to various quacks and everything, and now both egg and the sperm, they are gone. If the husband is totally azoospermic, and or let's say the husband is oligospermic, the count is very, very less, 1 million count. They have to go in for IVF. There is no other option. So such is a group of patients in which we directly say go for IVF.